Hello, I'm Park Young-min, the head doctor at the Gangnam Dental Clinic. I specialize in dental cosmetic work and front teeth work here in Gangnam Dental Clinic. I'm going to answer a few of your questions in regards to dental cosmetic work. Dental cosmetic procedures such as dental laminate is the kind of treatment that others can see immediately. It's treating the obvious part of your teeth as you smile. For dental cosmetic work, it usually treats the teeth, but we also treat the gums as well. Overall, this kind of dental cosmetic work is designed to make your teeth look whiter. Some examples of dental cosmetic works are filling the teeth with resin. Another is covering part of your tooth with laminate. And when your tooth is decayed too much, crowning of the teeth. You may understand that all of these treatments are categorized as dental cosmetic work. In addition, if your gums show too much when smiling, or if you want to change the shape of your gums, all of these are part of dental cosmetic procedures. So, implants for cosmetic procedures are when you want to have beautiful teeth. For example, you may want to have nice gums, or a nice gum line, or you want other people to think your gums look nice, and even the shape of your teeth. Another example can be when you have a decayed tooth. So, it can be for those who want to treat their dental issues. They can go to a specialist that works with cosmetic procedures to go out there to get some advice before making a decision. Those who want to get laminate work done and the level of decay in their teeth doesn't look too bad, and they just want to have nicer teeth with laminate work, or even for those people who want to give a brighter image when smiling. Then there are some people who genetically have weak teeth or even decayed teeth. For them, getting laminate work done is a good choice to protect their teeth as well as making them look nicer. Laminate work is not easily done nor done the same way always. In some ways, it is similar to a cosmetic surgery, in the sense that doctors need to know what the patients want. So with that, the patient should go to a doctor who can fulfill their desire in the exact way they want it via consultation. And finding a dentist who can do what they need with proper communication and checking various factors, that can bring out the best results. There are many checklists in this process. The first thing that the patient should check is who their doctor is. Next is to check how the manufacturer made your dental crown. You should go through lots of dental cases as reference to really know what you want in order to deliver what exactly you want from your dentist, so that we, on our end, can measure whether we can actually proceed with the work or not and explain what we think. And in this process, we can come to an agreement at some degree. All of this, discussing the kind of treatment the patient wants, the duration, the budget, and the doctor's experience, is to come up with the best outcome with the patient in consideration. There are a lot of things to consider, and it is going to take a while to really discuss it right here in our office. What we usually do is run a simulation on how the outcome might turn out. To get the best outcome, what we should be doing is that we need to consider all different aspects and factors before the procedure. The curative process usually differs depending on treatment, but there is a common one here in Korea. Take dental laminate for example. For this patient, in the past, they didn't like resin treatment and jawline treatment, so we went ahead with the dental laminate instead. For the patient mentioned, we had to shave down their teeth because of the presence of cavities in between the teeth. It was of utmost importance to remove it before going with the procedure. When there are no tooth cavities, there's no need to shave it down. We can just move on to the procedure without it. For this specific case, we shaved down the patient's teeth as well as reshaped their gums, because that's exactly what the patient wanted. And before that, we showed them this simulation before we went ahead with the procedure. We tell them, this is what the outcome is going to be. The patient takes a look at the simulation, and then, when we get what the patient wants or is happy with, we as dentists try to make it as natural as possible. Usually, from start to finish, the entire process will take around 2 to 3 weeks. In terms of dental implants, patients wonder how long they can use them for. For resin treatment, as you saw from the previous picture, patients come in because of discoloration or because of cavities. This kind of treatment differs depending on the person and the way they look after it. So the general consensus is that 5 years is the common amount of time that these can be used for. For laminate and crowns, which shaves and covers the teeth up with ceramic, according to studies, it is commonly known that these things could be used for 10 years. However, the way a person takes care of them is a huge difference maker, so it's hard to put it in exact numbers. So rather than relying on quantification, take good care of it, as it is already good for 10 years on average, and it would last longer as long as you maintain it properly. These kinds of implants are usually used for the front teeth right here. But when there's a problem with this, patients go under a lot of stress, which can affect their social life. So it is important to take care of it. After the aesthetic treatment for laminate and crown, patients come to the office with swollen gums. That's because the gums were not taken care of, or the implants were not made properly. So it is required for the patients to brush their teeth well. For the implants, they don't stain that easily, so it doesn't cause discoloration. But the first thing to do really is to brush your teeth properly and keep the gums healthy. Second of all, if the gums are already well organized, the next problem that you have to deal with is that the teeth can either break or fall off. So if one stays cautious about eating hard solid food with their front teeth, I think they'll last much longer. Today, I briefly explained what cosmetic dentistry is. If any single one of you is in need of the procedures, please come give us a visit and let's have a nice chat about what you want and what you expect. And I'll be here to do my best in treating you. Thank you very much.